South Africa aims to increase the rate at which the most vulnerable are vaccinated against COVID-19. The Clinix will join this drive by providing vaccines to 60-year-olds peri-urban areas. South Africa has managed to vaccinate over 2 million people since the start of the vaccination program. Now let's discuss this further. We are joined via Zoom by Dr. Raymond Billa, Clinix Chief Medical Officer. Dr. Billa, thank you so much for your time this afternoon. Perhaps before we get into the interview, just as a first question, what's your reaction to how the South African government has managed the vaccination rollout program? Now, we know a lot of health experts have criticized the slow pace of the vaccination. What's your reaction to that?
Thanks, Sonati, for this opportunity to speak to you and the viewers of SABC. Well, we have to admit that there have been challenges, there have been situations that were beyond the control of the Department of Health and government as a whole. And my view is that we should not be looking at pointing out fingers at what went wrong, but we should work together as the private sector and the public sector and government to make sure that the situation, the opportunity that we have now to vaccinate our population, our community, we should take advantage of that and let's forge ahead and make sure that what we have now is an opportunity to protect our community. And as Clinix, that is the role that we are playing as a health group, that we work together with government at any given opportunity that you have to ensure that our communities are protected.
Now, Dr. Billa, maybe this is a two-pronged question. Why did you, firstly, as Clinix, feel the need to bridge the peri-urban gap? And also, how has your network of facilities, if I may call them that, been able to reach the most vulnerable in the country?
Well, we started first with the Johnson & Johnson, the Sisonke project, when we went out to vaccinate all the healthcare workers in our facilities. That's all the doctors, the nurses, and other, including the ordinary cleaner and so on. So we did our road and we facilitated that program together with other partners in other healthcare groups. We have 6 facilities within Clinix Health Group in the peri-urban areas, as you've indicated. And these are the facilities. Within Soweto, we have 2 in Soweto, the Tsepotamba Hospital in Dobsonville, and just opposite Chris Hani Hospital, Dr. S.K. Matseke Memorial Hospital. And in the Vaal, also the Naledi Nganyesi Hospital, and in Vosloorus, we have Tselong Empilweni. And also in the CBD, we have the Solomon Sticks Murray Hospital, that we work together. And outside of Gauteng, we have Victoria in Mahikeng. And we hope to start vaccinating also people right in the city center in our new daycare hospital. And so we partner with government and we see the need that we need to ramp up because the progress has been quite slow because of the reasons advanced earlier. So we hope that as Clinix, we can partner with government together with other partners because we work together with other health groups to make sure that we ensure that those in our communities, because they are quite disadvantaged in many ways, and being well placed in those communities, we see a need to go all out to make sure that they also are getting their vaccines, that they can be protected.
Now, we heard today via the acting health minister that over 2 million, just over 2 million South Africans have been vaccinated. How are you going to be supporting and complementing a government's efforts? And also, how many people are you hoping to vaccinate?
Well, we welcome the announcement by the minister. In this particular weekend, as we roll out, it's more like a relaunch of the rollout because we want to make sure that over the coming weekend, we ramp up the services. So we'll be, in the past few weeks, we have not been doing any vaccinations over the weekend. But starting tomorrow, we'll be vaccinating at all these facilities I've mentioned from tomorrow morning at these facilities that I spoke about from 8:30 in the morning till about 16 hours or so, when depending on the numbers of people that are coming. And we also want to send out a message to the communities that we see all those 60 years and above, anyone who's a healthcare worker registered, and because the constraints in the past few weeks has been that, particularly in the private sector, that we were only seeing the insured, those who have medical aid. But we've negotiated with government, we've been given the go-ahead that we can even see those who are not scheduled, or what you call the walk-ins. Those who are not yet registered, they can come into our facilities. We'll help them to get registered. So we make a call to the communities in these areas that we operate as clinics, that get as many people as possible to vaccinate. You asked me a question about how many do we hope to, because of the constraints, we know that at the moment we don't have as many as we want to, but each facility can vaccinate about 120 vaccinates per day, which is about 120 multiplied by 6. That gives quite a good number, just under 1,000 per day. So we hope that with these numbers that we can also add into the program that government and the targets that have been set by government. So we hope that this coming weekend, we encourage all those communities, family members. We know that in our areas, people do not have these fancy gadgets to register themselves. So we say, if you are not able to register, please do come to our facilities. We will assist you to be registered, and then also you'll get the vaccine, because we've got sufficient doses to vaccinate all those who walk through our gates at all these facilities that I have mentioned.
Now, as we wrap up, Doc, I just wanted to find out from you, because you are in areas where we're seeing a lot of vaccine hesitancy, how do you manage, how will you manage, or at least your team members, because you are essentially in areas where a lot of the people cannot have the necessary access that people in urban areas can get? How do you manage to educate those people who, number one, do have that vaccine hesitancy, but also are hearing a lot of different, or getting a lot of different information from various people in terms of side effects, etc.?
Well, vaccine hesitancy is a big problem. We're quite aware of that. And what we are saying is that, look, we are still alive. I've had a vaccine and I'm here, and there are many others who have been vaccinated. And as health professionals, we can guarantee that these vaccines are safe and efficacious. And what we are doing within the group is that not only using the media, thanks for the opportunity to be on national television, but we also work with our local radio stations. The other week, I was on one with the local radio stations, and we spoke there. We speak in the language that the people understand. And so they are quite keen. I mean, when an 83-year-old lady, as soon as I stopped and I dropped a phone call, she picked up the phone and she called and said, "Danam, I also want to be vaccinated. And how do we do it?" And we're making plans with our marketing manager and marketing team to make sure that we go into the communities, and we're hoping that as clinics, we will make transport available to those members of the community who are not able to come through, and also they can call us and we can talk to them and explain to them. And we are fortunate that we are right there in the communities where there might be vaccine hesitancy, and we can talk to them. They can just walk across and speak to us, and we will be able to assist. And we can work with other partners. And myself, I work with other NGOs and faith organizations, and we've been dealing a lot with this vaccine hesitancy. We communicate and educate as many people as possible through other stakeholder engagements, not only within our group, but also we engage with other stakeholders so that we make sure that we partner with them and we spread the message that vaccines are safe, and they'll be there, one or two side effects and one or two breakthrough infections, and we are okay. I was one of those who got infected after being vaccinated, but here I am, and I went through that. It's one of those things that we know may happen because of many factors. And I must say that we want to thank the Sisonke project, because they kept in touch with me and they talked to me and checked if I have any side effects, and just mild infections. Just like the researchers have said that this vaccine helps to prevent hospitalization, severe disease, and death. And I'm a prime example of what the vaccine can do and will be able to do to any other person who gets a vaccine.
All right, Dr. Billa, thank you so much for your time this afternoon. We really appreciate it. Dr. Raymond Billa from the Clinix Chief Medical Officer.
Thank you very much, Nati.
Thank you so much.